I'm joined now by Xi Chen, Assistant Professor of Public Health at Yale University School of Medicine. Let's start with just the overall situation in China on the mainland. What are we seeing now? Any signs that things might be slowing down in this latest surge?
Thank you for having me, Mike. In the recent few weeks, Shanghai has experienced a fast growing virus spreading, and before Shanghai, Shenzhen, and Hong Kong also experienced a very similar fast growing trend. But after very stringent public health measures ongoing, and in the past few days or weeks, Shanghai has already seen some slowing down of the transmission, although the cases are still accumulating. So this wave of surge is very different from previous waves because the virus is more transmissible. People are having COVID fatigue, and the transmissibility of the virus leave very little time for health workers, health authorities to respond.
One of the other problems has been asymptomatic cases. They seem to have dominated. It's been a big problem, right? I mean, if you're walking around and you don't know that you have it, it's easy to spread it to others, right?
Right, that's a very important difference, and especially when you catch a virus infection at the beginning of the infection, it's very likely to be asymptomatic. So that's why we see in the recent days some asymptomatic cases becoming symptomatic. And also when people having more immunity built by vaccination, then the virus infection turned out to be more asymptomatic. So those are accumulating and to causing extreme difficulty to clear the infections in the society.
We've been focusing a lot on Shanghai, and you mentioned it as well. Let's talk about some other areas of the country. I mean, we started the broadcast by talking about Guangzhou. I mean, do you see other potential hotspots cropping up? What are areas of concern, do you think?
Yeah, I think any cities in China now needs to prepare for a future surge. So we already see different provinces already start to build the makeshift hospitals. That's one step towards preparation. Another thing very important before the local surge, it's important to accelerate or get a faster vaccination campaign. So far, we say that the vaccination rate, the new people getting vaccinated at a daily basis is declining. This is perhaps because of health workers are moving to other responsibilities, for example, fighting those infections. But in the long term, in order to fight the different type of variants, it's very important to have higher immunity, especially for the more vulnerable population, especially for people about age 80. In China so far, only about 20 or 25% of older adults about age 80 receive a third dose of booster. So that's alarming. So China needs to strike a better balance between a short-term zero COVID policy and think about even longer term how to deal with this virus spread in the future.
Yeah, the zero COVID strategy has been very effective up until just recently, and this variant just seems to spread so wildly. Do you see this as really kind of, instead of just being focused in that area, a multi-pronged approach like you're describing, perhaps a push to get more vaccinations into people's arms? Is that what's needed here?
Right, there are more and more spillover to other cities, regions. That's not only happening in China, but other countries. More and more asymptomatic cases building up, occupying the quarantine centers and the makeshift hospitals. That caused a lot of trouble and stress to the healthcare system, especially for China, which is very hospital-centric. So far, it's very difficult to build new hospitals or supply more ICU beds. But China still have a large room to prioritize those with severe conditions or higher risks. So the ninth version of China's COVID-19 treatment plan just released by the State Council has dealt with some of these issues, try to think about how to prioritize people with higher risk. But more such arrangement in details has to be made before the virus spread to a bigger, a larger economic, geographic scale.
Yeah. Professor Xi Chen, always a pleasure talking to you. Thank you so much for your insights.
My pleasure.